Great. Good. Thank you. All right, we'll do our call to order. The Community Engagement and Collaboration Subcommittee has now commenced. It is June 18th at 1 p.m. or 1:03 p.m. We ask all commissioners and guests to mute yourselves until called upon to speak to avoid feedback and background noise. For those who have dialed in using the call-in number to unmute and speak, dial *6 on your phone. Also, prior to speaking, please announce who you are to identify yourself. As a reminder, this meeting is being recorded. We ask that you only use the chat function to request to speak or to announce that you're leaving the meeting so that we can track quorum. Also, to comply with the state open meeting law, attendance and votes will be done by way of roll call using audio, not by using the chat function. Okay, so we have HCD update.
Mm-hmm. Is my mic on? Yes, my mic is on. Hi everyone, I'm back. Um, I hope you are all aware that State of Arizona Housing Department of Housing awarded the city of Tucson, specifically El Pueblo Housing Development, a LIHTC, Low Income Housing Tax Award for El Rincón, which is in Barrio Nita and Presidio neighborhood. And the state also awarded Gorman and Company LIHTC Award for Stone and Speedway, and that is a joint development with the City of Tucson and El Pueblo Housing Development, and so we're very happy that these two awards came in. Stone and Speedway is the first phase. El Pueblo will make an application next year for a second LIHTC award. And we have a new employee, a couple of new employees, um, and we have an intern, and she's in the meeting. She's not a panelist, but Camila Benning Sapien is an intern here, helping us out for the summer, and that's it.
Wonderful. Thank you. All really great news. And although we can't see you, Camilla, welcome. I'm sure the city's really excited to have you. So thank you, everybody. Before we jump into the agenda, if it's okay with everybody, I did want to talk a little bit about the committee itself. Um, and I'm going to preface this by saying I understand people are extremely busy. Many of you are working and, have tough jobs. However, um, we had talked about sort of the direction we want to go, and I want to do a check-in because honestly, I'm getting no feedback from anybody. Hopefully, you're all getting the materials. And again, I understand if people are busy, I don't expect you to spend hours, but I want to really discuss whether it is realistic that we keep moving forward in these areas, um, because they do require some level of commitment and work on the part of the committee. And I want to be very respectful. For some people, it's just not possible because of their work or their lives. I understand that. But I just want to be really clear because, again, I think one person has responded to me at all ever. And so you can imagine it's a little, um, I'm just, I want us to be honest. Is this something we can take on and accomplish with this committee? And I'd love your feedback.
Well, if I may, it's Mike, everybody. Keeping in mind that I'm ex officio, um, I'm willing to attempt to try to contribute as much as I can in any way I can. Um, but I wanted being ex officio, I'm wondering, I feel more I should be more in a supportive role than anything else. Does that sound right to everyone?
I think being and I will ask Neto to jump in here. My understanding is that on the committee, it's not the same as the commission, and that you can be an active participant. But Neto, maybe you can clarify that.
That's my understanding as well. Um, in fact, think you can vote on a subcommittee, whereas of course you cannot vote on the full committee.
And
So you have full participatory um, what's the word I'm looking for? You are able to fully participate.
Okay, cool. Thanks. Because overall in general, I appreciate a seat at the table, just in general. So,
Okay. All right.
I appreciate that, Mike, and I think your voice is really important here. Um, I just don't want to feel like I'm one person. I can't do all of this, and I really am looking for at least feedback or comments. And I want people to be honest. If they're going, I am just too swamped to do any of this, that's fine. I just need to know. I've been sending information, I've been asking people questions, and honestly, I've only ever heard back from one person. So, you know, is this something we should continue to focus on? Or do we need to bring on other committee members, ex officio, not part of the commission anyway, but full members of the committee who may be interested in, being more active?
Uh, I would like to, I'd like to put forth the suggestion that we not mute ourselves and raise hands to have a conversation because it it, it disrupts the spontaneity of exchange when it's this formal. That I, from my understanding, this committee is what we identified as the need to educate and educate about the root of homelessness and to bring that forward to community. Do I think, is that correct?
Yes,
Okay, good.
that was the agreement that we had. Yes.
Well, I am 100% behind that.
Great, thank you. And I agree, unless there's some technical reason why we shouldn't, that we don't, we just have a conversation right now, because I may not be able to see hands as quickly. But again, I would just love to hear from other members of the committee because I want us to be open and honest if we're going to work together as to what is possible, what can we do, or if people are saying, I just can't, again, totally respectful, been there, done that, understand there are times you're swamped. But I need to have a sense before I keep going and doing things. And then I feel like I'm kind of, whistling into the air, and I really need people to be honest here.
I can share. So thanks, Anne, for sending things. Once the school year ends, things just get really tough for me. And I happened to be out of town for most of the time since the last meeting. But I'm here too, fully committed. Um, I think I would offer, in addition to making sure that we do the work in between meetings, we just maximize our time when we meet so that we can actually maybe finalize some things. But yeah, but thank you. Appreciate you taking the lead.
No, thank you so much. I appreciate that. If I can maybe ask one thing, because I understand it's summer, people are gone. I totally get it. If people could just let us know, either go through Neto and he can let me know, or send me a note directly if I send you something and just say, sorry, can't be there, or I'm swamped, or I'm on vacation, I would really appreciate that. Just, I am totally in understanding if you're really busy or if you're away. I'm not going to bug you. I just would like to know. So, and I also appreciate your comment. We want to get some stuff done. So we do have a heavy agenda. Any other thoughts from, I guess that
Yeah.
just leaves Kenny.
Uh,
Sorry.
no, appreciate the work that you've been sharing out. And I guess one kind of working thing would be, if there's a way to turn that into either like a SharePoint document or a Google document. So, in between times, right, that we could be adding comments, adding to it so it doesn't feel like, just kind of typing in the dark in a way. Um, uh, really support the effort. I think it's a nice companion. I actually have the kind of the city booklet piece. And so one of my questions too is, is there a way that this can help complement the kind of the handout resource? Um, so I don't think I've been able to track down a digital copy of it just yet, to just see things side by side. Um, but yeah, the draft, I think, we had received the outline. I thought we were going to talk about that, but then it's amazing, the 20-page draft that you've already put together
And I
too.
got carried away, and I'm not like, I'm happy to have people push back and edit, so we'll, and Kenny, thank you. Sorry, I don't mean to cut you off. Um,
Oh no, just in full support. I think it's yeah, fleshing things out, those are the next steps. And yeah, if we could, in whatever fashion, if that could be something that like we can edit offline or you just even do it live as we're meeting, I think that might, provide a pathway for us to kind of chip in a little bit more, let's say.
Great, thank you. And I did say I would do Google Docs, but at the time, I think not everybody was on Google, and that's one question I wanted to ask. Does everybody have access to Google Docs? Because it is much easier to edit and make comments.
Yes.
We all good. Mike, do you have Google Docs?
Yeah, here's something I just noticed that was to me is really strange. Now, I just noticed this. I did a search for your emails, and initially when I opened one, it was the message about the change of the date, the meeting date, and all that kind of stuff. I saw nothing attached to it, so I looking through some other stuff. For whatever reason, I came back to that email and I saw the documents. Didn't see it the first time,
Hmm.
but I saw it the second time.
It's
So
called-
it could be just me, but I just thought I'd mention that.
Well, again, that will be helpful. I will start sending stuff on Google Docs and just ask that you send me a quick got it. So I make sure that everybody actually has the document. So if you just do a quick got it, thanks. And again, let me know, say I'm swamped this week, I can't get to it. That's fine. I just want to know because I'm sending stuff out and I'm not knowing where it's landing. So I appreciate that. So I will be I'll be good about doing the Google Docs. And again, just ask that you check in and let me know kind of where you're at. I appreciate that. Any other thoughts or comments, and we can move right into the agenda? Great. Thank you all so much. I appreciate the feedback. Um, so the review of the materials. And I know I sent you a lot, and part of that was because I had sent the outline, didn't hear anything back, so I kind of just kept going. I recognize there's one huge document, but also thinking also having a quick, what I'm calling an at a glance guide, but that for some people, something a little bit more intensive could be useful. I did speak to Anne at the city. We got together last week. And so we've also been talking about, how this could be used. And I think to your point, Kenny, making sure that we are either linking or in conjunction with the city materials that are coming out. We're not trying to provide service information. I think that's been done really well. This is more that information myth, whatever we want to call it, but the myth busting side of things. So I'm having a little trouble with my screen. Mike, oh, sorry, you just popped up in the middle of my screen. Did we want to jump into looking at just some feedback on the community education pieces? I know, Mindy, you had sent me a comment. Thank you. I didn't have a chance to get back to you. Appreciate that. And I'm just pulling it up. Does everybody have a copy, or should we put it up on screen?
I just want to make a quick comment about two comments. I thought we were going to be working on sort of a flyer, like a trifold piece of paper that would be easy to put out into community. And if it's possible, the 27-page document, because I was getting ready to print it. And I saw it was 27 pages, and I don't want to use that much paper.
Totally.
I don't read and retain information from a computer screen. I need to hold it and underline. That's just a one piece. So I just want to get clear that a bigger document, perhaps for bigger agencies or Better Business Bureau, or, kind of refining out who we're going to be handing out a bigger document to versus a community flyer.
Yeah.
Okay, good. And then my cat is looking at me in the most adorable way. I'm going to have to share that I am in disagreement with the research that was in that document, specifically around mental illness. So at some point, please let me know when I can share those thoughts with you.
Okay, no, I appreciate that. That's why this is very much draft form.
Yeah.
Why don't we go through the shortened version? Because that was what we had talked about. Like I say, I just got real ambitious and was thinking, and also in talking to Anne, that as you said, Mindy, there may be some people that having more information with research attached to it that they can cite could be
Yes.
helpful, but it's not a community thing that we'd hand out 27 pages, I promise.
Thank
Okay, so why don't we does everybody have the short at a glance, or should we pull it up? Would that be easier? It's homelessness myths, facts, and evidence-based solutions, but it's the short.
this one.
Okay. I I just make sure that I have the same document.
I don't think I have that one. I'll keep looking, but I don't think I've got that one.
Myths,
Okay.
facts, and evidence-based solutions. I see it.
Okay. Yes. Can we post it?
What you mean posted? You want to
Or
share
I
the
mean, can we
screen?
put it on the screen? I
You
think
can
that
share.
might be
You can share your screen, and you have co-hosting.
great. Thank you.
Yeah, if you can make it larger.
Okey-doke. I've got a double screen and it's kind of
Oh.
irritating because I sometimes actually lose the document here.
And I do have it. The file name is different. I see, yeah, I got it. It's just what you read off is not the file name I was looking for, but I
Okay, and it's not coming out large.
Now
What-
it's large, very large.
Okay, we'll take it down a little bit. Ah, sorry. Now I can't. Now we're gonna have minuscule. I'm so sorry. I don't know why. I've shared a million times on Zoom. Is that
That works.
okay? Great. So why don't we just kind of run through this? Any thoughts or comments? And then we can talk a little bit about, any edits that we might want to make. And if we're good to go or we want to add or subtract, then next step, how do we publish and where do we use this? Does that sound okay with everybody? I don't know if we'll have time to get into the long version, but we'll do this one. Okay, so again, the big picture. Does anybody have trouble with this statement? Homelessness is primarily a housing issue. Not that there aren't other issues that are obviously feed into that, but that,
I disagree with that.
okay. Do you want to speak a little to that?
Sure. For most people, I believe homelessness is primarily a housing issue. I totally agree with that. But I feel that for people with serious mental illnesses and other vulnerable adults with disabilities, including the elderly, that it is a lack of service dollars that are available to help people stay stable in their housing. So that's the housing first model, and I get that. But
Yeah, I hear what you're saying. Any other thoughts?
Speaking it up because I won't be able to live with this.
Okay.
Okay.
Any other thoughts on that?
Hey, Mindy, are you speaking towards eviction prevention? Is that what you're touching on?
No,
Oh,
in my experience, that for people who don't have a serious mental illness or uh, primarily people with mental illnesses, it is the lack of service dollars that has created the crisis of Yeah, it's the lack of services to keep people stable in their housing. And that's where the housing first model comes in. It, I've been in Tucson, working in indigent behavioral health since 1986, and we had systems in place. And I think some of you have heard this over and over again. And we had systems in place where we would be able to keep track of and support people in their recovery, in however meeting that person where they're at and providing the supports and services that they choose. And to say that there's a myth here that primarily the people that are homeless are experiencing, are mentally ill. From what I had gathered in other conversations, over 70% of the people that are homeless are individuals with serious mental illnesses. And your data is saying something else, and I disagree.
Um, so what the evidence shows is, and I think one of the big issues, and this is where I kind of went into the longer issue, people with severe diagnosed mental illness is about 30%, and those are national statistics. Now, communities may vary a little bit, but what we know is that homelessness and trauma can cause, yes, mental illness. Absolutely. So what you see on the streets is people who are experiencing extreme trauma, childhood trauma, or, you know, flight or fight, all of these things. But what the evidence also shows is that when people are stabilized and yes, have support, and sometimes it could be medication, they are able to live perfectly normal lives. If you look at the number of people in this country with mental illness, it's tens of millions of people. But because they have stability, safety, supports, all of those things, they do just fine. So one of the concerns I have, because I've seen it in real practice, is labeling everybody with mental health. There's a push to reinstitutionalize people. They're all crazy, but we know that's not true. Now, there are people who have severe mental illness, extreme, schizophrenia, bipolar, those things. Those numbers are much, much smaller. And that's, again, major research that's been done all across the country. So I'm not suggesting that mental illness isn't a serious issue for people experiencing homelessness, but we have to be so careful that we don't feed into this idea that everybody's mentally ill and a drug user, and that if we just we institutionalize people and force them into drug treatment, we'll end homelessness. That's not the case. And again, there is a direct correlation between housing affordability and people on the streets, and that includes people with mental illness. So I hear what you're saying, and I'm not disagreeing. I'm just saying that trying to sort of bring down the rhetoric that everybody's crazy and everybody's a drug addict on the street. I don't know if that, I would love to hear from other folks, kind of your thoughts on this.
I appreciate that, Anne. I thought that was well put. I think it's, there's many different situations that people can find themselves in. If you're couch surfing for half a year, just like from one place to another, like that counts as homelessness, right? If you're doubled up or overcrowded. So I think it's a pretty straightforward statement. But I think what we might be seeing are the most extreme cases that come to mind. And I think part of what we can do is help destigmatize and paint a larger picture of, there are actually more folks, experiencing homelessness than the very, most visible cases. So I kind of wonder if one way to tackle the big picture too is to start with kind of that the vision of the right type of housing for a range of situations, right? If maybe this particular, what's different about this particular resource or this kind of message that we're putting out is, um, we want to see uh, uh, the full spectrum of housing being met, whether I'm just graduating from school or I'm striking it out on my own after finishing, high school or something like that. Um, that we have the full range that meets the needs that are out there. And it's maybe that's part of the positive message that kind of helps, build, okay, there's a range of solutions, or there's a range of ways that I can participate or support or make the connection of um, how to have a place for everyone in our community.
Thank you, Kenny. I appreciate that. That's really, really helpful. Any Robert or Mike, any thoughts from you
I
folks? I don't
think
want to push you if you don't want to say anything, that's fine, but
I agree with the we don't want to stigmatize or amplify like stigma and misconceptions. I think this statement, the other thing it does, it speaks to the intersectionality as well. We can be experiencing poverty and be suffering from domestic violence. And so I think it does that too. So I think as a big picture statement, I'm pretty comfortable with it as well.
Uh,
Mike,
Two things, yeah, real quick. So Kenny, I just because you said couch surfing, I just wanted to just toss on top of that. See, I was couch surfing for 10 years, and I never knew I was quote unquote homeless until somebody at DES told me I was homeless. I did not know because everybody was asking me, "Are you homeless?" No, I'm not homeless. I'm couch surfing, but so I just wanted to throw it out there. So
yeah.
let me and not to rewrite the document, not to get into a long conversation about this, but I have a suggestion, not saying it's a good one, but what do you think about this? What if it says, okay, the big picture. Homelessness is primarily a housing issue, but maybe right behind that, something similar to what you have down in maybe the third paragraph, no, farther down, I'm sorry. The data suggests that the challenge is not simply a lack of services. Somehow put those together. Does anybody, I mean,
No, I appreciate that. And actually, as we're talking, what's coming to my mind is that to Kenny, to what you just said, maybe we put something in here that talks about the different kinds of housing. It's not just sort of middle class housing that somebody can buy or rent an apartment, but we're talking about the full spectrum of housing, which includes, to Mindy, your point, intensive services for people. It could be we need senior housing, we need housing for people with, extreme mental illness or trauma or domestic violence. So we could either do it as kind of a note or put something in there. When we're talking about a housing issue, we're not implying that it's one size fits all. What we're saying is we also need housing with real support because of all of these other issues that go along with homelessness.
That was going to be my suggestion.
So if we put something in there that kind of expands that, so because I understand what you're saying exactly, Mindy. It sounds it's a very bleak statement. So we can put a note in there. Do people feel comfortable about that? So we expand what we mean by housing. It's a housing problem.
And it's a lack of services and support issue.
For those who need it, it's housing plus services. Exactly. It's
Yeah,
not housing only,
correct.
but for some it is housing only. You know,
Correct.
a lot of is economic. So if people are comfortable with that, again, what I will do is I will put this document up on Google Docs and I will make some changes based on our conversation, some edits, but I'll leave them as edits. And then if you folks can kind of go in and yes, that edit sounds good, or well, I'd reframe it, or what about adding this? We can do that. Does that sound good?
And I have a question. I came from food banking, and so in food banking, we talked a lot about hunger and food insecurity.
Right.
And So I'm wondering what role housing insecurity plays in food insecurity. Implies there's a level of stress, anxiety that you don't know what you're gonna eat tomorrow. And I'm wondering if how that interplays in this space, being newer to this space. So I'm just asking that question. I don't know what the answer is.
That's a really good one. I think traditionally the homelessness sector that was funded by used to be funded by HUD, focused on actual homelessness, and excluded it excluded couch surfers, youth, those kinds of things, and they didn't talk about housing insecurity. That's coming up much, much more, and certainly something I think we could incorporate in here because the percentage of people who are housing insecure in our community is huge. One paycheck away, one car repair away, one medical emergency away, and they're homeless. So very similar to that
Yeah.
food insecurity piece. So I like that, and I do think that is something we can talk about.
Okay.
Yeah.
Well, I was looking at the some of the examples, looking at older adults uh, or seniors. At one point, the numbers there are like 30,000 housing insecure older adults in Pima County, and so it doesn't really paint the full picture of what's happening. So
Um, this is one of the things I struggled with and why you ended up with a 27-page document, because it's things like that that are so vital. And yet, the more we add those kinds of things, the longer this
yeah,
gets.
yeah,
So I do think we had talked about one point about maybe having QR codes or links that keeps it short, but if you're really interested in sort of seniors, click here. And Robert, we could connect with some of, the things you have and you're doing and talk about housing insecurity and,
hmm
all of those things. So I think there's some opportunity
great,
to do that as well. And I think the seniors piece is a really vital, vital piece. It's the fastest growing population in the country of people experiencing homelessness. And, you know, there isn't the stigma attached. And I'm not saying we should not think about other populations where there is a stigma. Obviously, we should. But it's a nice entry when you're talking to people about housing and homelessness and to get them to move away from kind of it's all drug addicts to
hmm
say, these are our parents and grandparents who've worked their whole lives, who've been homemakers. And
yeah,
suddenly, because they're on a limited pension and their rent goes up, they're gone.
yeah,
So sorry, that was an aside, but I'm really passionate about that. So I would
yeah,
actually love to talk to you more, Robert,
great.
about that. All right, should we move down? So Mindy, is that comfortable for you if we expand that part about and definitely talk about the service portion of it?
Yes.
Excellent. Thank you. Um, Anything else in that first couple of paragraphs that talks about the
I would,
factors leading into homelessness and housing affordability?
yeah, just as we're, thinking about like editing, right? And part of that is tone or like what gets foregrounded. Um, just wanted to see, it seems in my mind, this is a document that would be, it's not it's not the handout for necessarily, right? Which the the sheet I was talking about for folks that might need immediate access to services. It's sort of
Right.
a document for our community and to speak with a broad audience to sort of a primer or a primer for how to start being involved or make the connections with um, uh, if they are concerned about what's going on in our community, how they might participate, how they might have a few fingertip facts to inform, um, and uh, and to me that's sort of like the earlier comment about like okay painting a vision sort of at the beginning too, like what is it that I'm going to be entering into participating in or finding my own place in. Um, just wanted to see if we kind of shared that kind of that assumption or that perspective still. And I think that kind of maybe sets the tone for what kind of edits make sense, how much definitional vocabulary stuff. Maybe that is actually very helpful to have at the foreground, right? Literal homelessness, or these other terms like couch surfing that we might be familiar with. What's the technical definition versus our like lay or colloquial, everyday understanding of what we see.
Thank you. I really I love that. Yeah, Robert, were you gonna? Oh, I just saw your screen go green, so I thought maybe you were. I agree with you, and actually, as you're talking, Kenny, I'm going, yeah, this is too much research based. And I'm not saying we don't want to have research and facts, but I do think the tone needs to be more accessible depending on who we're using it for. And again, I kind of based this off of something I did for my board of directors, so it was a little bit more direct, but I do feel making it a little bit more sort of community oriented would be helpful. And maybe we don't need some of those terms, getting into trauma-informed care and everything, but talk about trauma, because I think that's really important that people understand the trauma of homelessness. But I
Yeah,
like that.
I do.
yeah, I fully support. It should be evidence or and research based, right? Whether it's through like footnotes or like uh including where some of the information, if you want to see the whole report from TPCH, here's where you can do that. I think I agree with you that is super important. Um, I think for me, it's helpful to just kind of be on the same page on the tone, and then let's throw it all at the wall, and then we can edit with that in mind. So I wouldn't take anything out, but I might, uh, I'm sure as we revise or go through it again together, I think it's easier to go from a lot to edit down versus like, okay, I have to find all that.
Start from scratch. No, I really appreciate that. I think you hit something in my brain that went, oh yeah, yeah, totally hear that. So and that would be something great in the, if in the Google Doc, if people could, I think starting warmer and friendlier um, is, it's kind of like as a community, we see that this problem is growing, and it's going to be as a community that we do something about it. Here are some things you may not know. Here's some ways you can help. Something that's a little bit more accessible, I think might be a nicer way of going if people um, are okay with that. Yeah, I like that very much. Thank you. Yes, Mindy.
Thank you. Oh, I'm doing all the wrong things. Lower my hand. Okay. Uh, I have a question about the Tucson and Pima County snapshot of people experiencing homelessness. For some reason, the last point in time count that I remember seeing a number for was bigger than 2,218. I could be wrong.
No, and that's a good call. It may not be in here, but I put it in everything else that these numbers need to be verified with the city and county. So these are placeholders. So
Got it.
yeah, I appreciate that you caught your eagle eye caught that though, because yes, very definitely these are not. We would have to verify any data before putting anything out there. So I think I just pulled up the point in time count, and I may have gotten the previous years or something. Um, and again, oh yeah, there is a little, if you see figures should be verified before publication. I did sneak that in there. So yeah.
Thank you.
Um,
And one thing that, I've learned too as I've engaged with the area agencies on aging is like moving away from talking about seniors, but just referring to them as older adults.
Thank you. Great.
I embrace my senior citizen status with every fiber of my being.
I actually personally like wise adults. That's what
Yeah,
I
I
call
love
my,
that. I love that.
But I appreciate that. Thank you. Any terminology that people see like that, if I'm using an expression, language changes and sometimes you use something and you get a student and find out. The one I learned recently was stakeholder.
Mhm.
And, I didn't know that was actually a derogatory expression with our indigenous peoples. So, but I've had a hell of a time finding another
I
word
know.
for it. So I appreciate that.
Sure.
Um, okay, so um, to your point earlier, Mindy, the data suggests that the challenge facing Tucson Pima is not simply a lack of services. I may reword that because I think we do want to strengthen the fact that we do need more services. So I think that might be an edit to make to say it's not only, but that is an important piece of it. Um, okay. Now, this is something, excuse me, I'm sorry. I don't know if this is getting into confusion, but um, there is a difference. People think drug addiction causes homelessness. We know it makes you more vulnerable. It's not a cause of. Um, and I'm talking big picture. I'm not talking individual people. So, but what do people think? Is this something we even want to include or should we rework it? I always use, when I'm talking to people, I use an example and that makes it clear. I always talk about COVID. When COVID first came out, we were all told if you were over 65, if you had diabetes, if you had a chronic illness, you're more vulnerable to getting and or dying from COVID. But nobody suggested that being over 65 causes COVID. And that's kind of the distinction that I'm trying to make. Certain people are definitely more vulnerable, but that's not the cause of homelessness writ large.
Well, in the spirit of that, what about things like communities of color and other other um, things that could impact or enhance that, you know?
Right? Racism is an elemental cause of homelessness. And I just realized as you said that I don't think I talked about racism, which shame on me, because it absolutely is, um, again, cause. I would say it's actually more of a cause because it's
Yeah.
fundamental to why we have racism with, redlining and all of that.
Hmm.
Um, so it's such a hot button issue right now.
Yes.
So I'd love people's thoughts about that because ethically I feel horrible about leaving it out, but I also want to reach people. I don't know.
Bigotry, racism, kind of are the
I mean, we have a city uh, government that's, I think, has been, at least in the most recent times, very supportive and open to really having that lens. And so, I don't know, yeah, from like older adult issues, it's definitely the most impacted are folks of color, women of color, caregivers who take care of older adults are immigrant women. And so, I mean, to me, it just seems like an important thing
Yeah.
to think about what language we use, but just at least include it in some way.
I
Yeah.
wonder if, we were talking about age as well, so like demographic factors, if that we could
Uh-huh.
at least put that in for now.
Yeah.
So, that's kind of the biggest umbrella perhaps to kind of without unpacking all of that.
Mm-hmm.
Yeah, there's demographic, there's economic, and then there's the personal, right, issues that all lead into. Although again, I think racism is actually truly is a cause. And I'm sitting here going, I cannot believe I've taught that and spoke on that and written on that, and I can't believe I missed that out of
And
here.
we have a group and we're all talking about it. We're
No, it's great. I
at
appreciate
each other.
Okay, so again, let's figure out maybe how we can put that in a way that's not going to sort of immediately cause a backlash, but it is true and elemental. So I think we need to include somehow.
And to the point about the city having some good tools too, I was reminded about the TEDS, the data equity strategy. So maybe
Mm,
there's some language we can pull from there.
equity, and sorry, I'm still learning all the stuff with the city and county. And what's it called? TEDS, did you say? Oops, you're muted, Kenny.
Sorry, I just put a link in the chat.
Thank you.
Um,
Thank you so much. Okay, great. All right, so and now we're getting into the actual myths. And again, we can rephrase that. These are all placeholders if people think of different words. Common perceptions may be better than myths. I don't want people to instantly go, what are you accusing me of? I think the mental illness one, and Mindy, I'd love your thoughts on this one.
I, 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 even though research is, if my thought is that it's people with serious mental illnesses without the wraparound supports of will become and do become and are much more vulnerable to homelessness without the recovery supports, the wraparound.
Right. Um, I
And
didn't address this, but to that, the fact is there are people on the streets who have severe mental illness. And stable housing is not going to be enough. Even just supportive services like we do in permanent supportive housing sometimes is not enough for people.
that is correct.
We
And
ran into this problem in our permanent supportive housing because everybody would be put in there, and we had people who needed a much higher level of care,
it's
but there
called,
were no resources and no way. It took forever to try to deal with that. So maybe a little note. I just don't want people to think that's the majority. That's, you know, small percentage of people who, in fact, and probably need some form of institutionalization. I use that word very carefully. But so a little note.
for me, the important piece is yes, people with serious mental illnesses are more vulnerable to homelessness. And one of the key factors of that is that services and recovery supports have been defunded. Um,
Okay, thank you. I'm
however, you
just taking notes here, so
uh, yeah. So
great.
many people that I have worked with in the past that had serious mental illnesses, I'm now seeing on the street, and those that haven't already died. And this is it's because we used to have supported residential care. We used to have, these are the crucial pieces for people with severe disabilities. And we put in curb cuts for people with mobility challenges. And, our society builds in the traffic lights that make a sound that allow people with severe visual disabilities to move in the world. Wheelchair accessibility is a mandatory in every state and federal building. So we have built in so many assistive technologies for other disability groups, but not for the disability group of people with severe mental illnesses.
Yeah.
You can go on about that, and you don't need to hear about it because
No, I appreciate that. And I think maybe there's some things we can do to, when Kenny mentioned earlier about a sort of what can you do? I think there might be some places where we could say, please talk to your elected officials about better support for, those kinds of things that are positive things people can do in the community. Because yes, even though we need more housing, we also need better services. And the underfunding of services always made it hard for us to keep people, even if they housed, because we didn't have the money for the supportive services. Um, Myth, again, people are homeless because they use drugs or alcohol. And
there are some. There are some people who have chosen addiction over paying rent, and I think it's a minority.
I would probably not use the word chosen because for most people it isn't a choice addiction, it is a disease. But I think there are people that addiction recovery is immensely difficult. Um, I just want to, it's all drug addicts. And I think what I'm trying to say is in some cases it preceded homelessness. Absolutely. To your point, Mindy, there are some people that, couldn't maintain a job, pay rent, ended up homeless. A lot of people become addicts after homelessness, or it's exacerbated, right? Again, we don't need to go word through word, but if anybody has any objections or like to change something, just let me know. And again, you can take more time. I'll send this out again. Um, and again, service resistance is another thing. Again, we know that some people say no, and some people it's really hard to get them. It takes time and it takes building trust. But at the end of the day, the only people I've ever seen who truly resist are people with extreme mental illness who can't really rationalize. Um, but the somewhere else, this is the one, again, please interject. The somewhere else, I'd like to talk to the city about some of those stats, and I'm assuming there's some research there in Tucson. But it's pretty consistent across the country that anywhere from 85 to 95% were living in the community before they became homeless. They may have moved here 5 years ago, but then their lives fell apart. They are Tucson residents or Pima County residents. Again, myth, housing first, again, supportive services and accountability. I don't know about the what works. I think maybe reframing this in a less technical language and not necessarily using all the terminology might be better. I don't know what people think about that. Um, again, supportive services, integration into community, the support they need, whatever that is, and recognizing that they kind of what happened to you, not what's wrong with you, that our experiences shape often our actions and can present a certain way when on the street. But when people are stabilized with supportive services, they become your neighbor. Are we good with kind of the rest? Any other thoughts, comments, additions? Oh, one piece I did not add in here, just make it even longer, is crime. And I did look at stats on crime and homelessness because, of course, everybody goes, we don't want that in our neighborhood because our poor children are going to be unsafe. So I did have a little blurb about the misconceptions about homelessness and crime. Mostly they're crimes of survival, theft, trespass, those kinds of things. All right. Is everybody okay then if we make some of those changes we've discussed? I send it out on Google Docs. Any comments, changes, or just say, yeah, that sounds great.
Yeah.
Yeah, Mindy, Mike,
Yeah, no, it's good. I'm good.
great. Robert and Kenny?
I just have a, also just being newer in this whole area, like just being mindful of like when we talk about experiencing homelessness, um, I know the issue of homelessness in general is different than, so I just don't know, like, and versus when we talk about the unhoused and those kinds of things. And so I don't know if that, maybe what the lens we want to use is as we talk about these things. But anyway.
Yeah. Um, Common parlance is either the unhoused, that's a little newer because it's a little less unwieldy than people experiencing homelessness. I mean,
Mhm.
sometimes when I'm talking a lot, I slip into the homeless, and yet what we're trying to do again through language is destigmatize. It's
Mhm.
not a state of being. It's not like
Mhm.
saying,
Mhm.
the the Americans.
Yeah.
Um, so, but if anybody has preferences as to how they'd like, homelessness is not a pathology. That's one
Yeah.
of the things we talked about.
Yeah.
Okay, we'll standardize some language. And again, happy to have people comment as they read through it, and you have more time to kind of think about it. But I really appreciate the comments and the direction. I think that's really helped me. So thank you so much, everybody. And I will get this out as soon as I can onto Google Docs. And I'm not going to go through the long version. Like I said, that was more um, me getting ahead of myself.
Yes.
Okay. Sorry, Mindy, go ahead.
Um, the last bit of research I did about what works under uh, it costs about $56,000 a person who's unhoused or experiencing homelessness uh, a year.
Hmm.
We're spending on jail, prison, first responders. But what's not in here is the income, the generation of going back to work and and the amount of tax dollars they're putting back in to the system. And I don't know if it needs to be in here. It's one of the talking points that I
Yeah. It's, this is kind of why I struggle too, is because there are so many pertinent facts, but we're trying to keep it. Um, so something about, because I think that is a very valid point, and some people, it was one of the reasons the Republicans brought in housing first was because it was so much cheaper, right? And they showed how much more effective it is from a cost perspective. Um, Leaving someone unhoused is extraordinarily costly, and maybe a little chart, the costs of homelessness, leaving someone homeless versus housing with supportive services versus treatment centers, which are extraordinarily costly.
your idea about in this flyer of putting QR codes.
Yeah,
It's brilliant.
great. Okay, we'll figure it out. So for our next meeting, if we can come back with a almost final draft based on people's comments, that would be great. And then I think we can talk about at that point where is this going to be useful? And I would love to find out, Robert, you're a good example of a nonprofit. Would this be useful to have something like this for local nonprofits and even for, some of your caseworkers, whatever you call them, to have is a little, because that's one of the things we did. Our staff said, "Oh my God, can I have that?" That's so helpful because they're talking to their friends, family, or they're in public and they're getting these questions. And they found it really useful to have a little guide. It was like, well, did you know if we just leave this person on the street, it's going to cost $56,000. But if we actually do this, it's going to cost $18,000 to $20,000 a year for taxpayers. So
It would definitely be useful.
great.
Yeah.
Okay. And that kind of leads into the next agenda item. I think we have about 28 minutes left. That took a while, but I really appreciate it. I think great feedback. We had talked originally in our committee about doing some increased collaboration and conversations with some of our nonprofits. We are a small group of people. There are a lot of nonprofits. So, but I do think if once we produce this, and I think having a longer guide that we could say, if you want this, this is more comprehensive, but this isn't something for everybody. This is just to give you more and then make sure we're connecting it, although they probably already have it, but with some of the city documents on how to get services, etc. Um, so I would really love to hear people's thoughts about how do we effectively have conversations with some of our nonprofits around, again, not around the service side of things, but around the communication side of things. Obviously, there's connection, real connection there, but
I think one way to, get to as many as possible would be to really go to the sort of the coalitions rather than just individual organizations. Like for older adults, for example, there's the Elder Alliance, and there are probably 30 to 40 nonprofits and others who are part of that. So just maybe really like maybe looking at what are those spaces, I think that could be a really productive use of our time.
great. I love that.
I have a
Um,
question.
yep.
Looking for funding to print everything out.
Oh, you're getting into the nitty-gritty now, Mindy.
Oh,
That's great. No, it's
mhm.
realistic. Um, so I've had some initial conversations, and my thought was, and certainly we'll talk to the city, not that I'm expecting them to fund it, but that they might have some ideas as well, is if we have some conversations, get some interest, then we have a case to make to go to a funder. Someone like, I was thinking, you're talking about groups, Robert. I was thinking about United Way. Would they be interested in sponsoring, say, a meeting about this? And then could we say, could you give us a small grant for printing? Community Foundation, some of those
Yeah,
groups.
that makes
Yeah.
sense.
So I think we've put the cart before the horse a little bit, but you have to show something to funders, and I think this might be something. And if we can get some of the nonprofits saying, "Oh, we'd love that. That would be so helpful. Yes, come talk to us. Yes, give us this." That'll help too. So we'll target. I don't know the new CEO of United Way, but she might be a good person to have a conversation with.
They're part of the Elder Alliance too, by the way. So.
Yeah, yeah, that's great. I think the Elder Alliance would be perfect because, again, as we said earlier, this is a subject that's really starting to hit our seniors in real ways. Um, so could I ask, I'll do some research, but I may also send a little note. If you think of any groups or likely agencies, we'll just do a running list of people and then kind of prioritize who should we talk to first. We also have an agency, Compass Affordable Housing, who's really interested in taking a bit of a lead on the communications piece. So, I can talk to them and see how would they like to collaborate. I think we're trying to get Tony potentially to come onto the commission. It was mentioned at our last commission meeting. Okay, so we'll do a running list if that works for people. If you have ideas, just put it down and we'll sort that out. I apologize. I've still got this remaining cough. The next piece is we had talked about potential speakers, either to come and talk to our committee or to potentially address the full commission, depending on who it is. Just taking a few minutes to say, does anybody have any thoughts or ideas? As I'm sitting here, Robert, I'm thinking it would be great to talk about what some of our seniors are dealing with in the community and how it's affecting them, and what are some of the things you and or other groups are doing, say in the Elder Alliance. I think something like that would be really fabulous. So I'll put Robert's name forward
We'd
to
love to. We would love to have that space to talk. So count us in if everybody else is okay with that.
great. Any other thoughts from people about ideas of who you think would be really great to come and speak with us?
No one specific. I'm just, my general thought was, gee, who does community engagement that we could just chat with real quick? All the agencies, all the groups, everybody.
Yeah, I mean, there's a lot. I think we want to, if we can focus our attention on populations and or issues. One of the things I was thinking, does anybody know the national, oh my gosh.
National Alliance of NAMI?
No, no, I know, no,
I'm
it's
back.
homelessness. It's not the National Alliance to End Homelessness, although I've worked with them really closely. I do know them, but I'm thinking more, it's the National Coalition for the Homeless. They are more of a grassroots lived experience organization. They have done a tremendous amount of work around racism and homelessness, but also really some wonderful work on how do we truly listen to the voice of lived experience in real ways that are respectful, that are, and the CEO, who is a good friend, I, somebody like that, because we talked about sort of alternating between local and either state or national.
I think that would be great.
Okay. I'm not sure, like, I know in the past you've had a lot of speakers, so I definitely don't want to duplicate. Any other thoughts or anybody from the behavioral health side, Mindy, that you think might be a good?
What about there's a behavioral health coalition. Uh, I'm a very new member of it, but I've been going to the meetings, so I could. NAMI's part of it, and COPE, a lot of these nonprofits. So that
Right.
could be
Yeah, if you want to maybe have a conversation is there anybody who's been really involved with the issue around
yeah,
homelessness who can connect those in real ways? I think that would be great.
great.
Um, Anybody else have any thoughts or ideas?
I do, but I don't know. Hey, Kenny, if you know who I'm talking about. So I go to the Alvernon Grant Initiative meetings, about the crime in the area there. Now, there's a new company group agency right there at Grant and Alvernon, and they're on they took over the old Circle K. Um, huh? I thought somebody was gonna knew what I was talking about. They're on the southwest corner, and they do outreach, but I didn't know if they would be worth bringing into the subcommittee or to the commission to just chat with them.
And Mike, sorry, what outreach do they do? Sorry, I may have
Uh,
disconnected for a
They
second.
do street outreach, but they're also involved in behavioral health and addiction. I thought maybe Kenny might know who I'm talking about. And I'm looking at Google Maps and I don't see it popping up the name of the new company thing that's there. Hmm.
I mean, if we could kind of investigate, that sounds like it might be really interesting, and but maybe have a conversation with them first to really understand sort of what exactly they're doing and their approach.
Right. They just
And
came to my head because they come to the Alvernon Grant Initiative meetings and some of the other meetings I have, as well as VIVA, which I can't tell you what it all stands for, violence intervention something, but it's basically the four high gun crime areas in town.
mm, I think that would be great if Mike, the next time you go to the meeting, if you could maybe identify somebody, and then again, one of us or you could have that conversation with them to find out a little bit more, and they might be a great, person to come and talk, or for us to do some of, our connecting with our collaborations. So, I don't know if you can, the next time you attend your meeting, maybe see if you can follow up and find out who they are.
Yeah, I'll try to check. All I can remember is the woman's name I usually see a lot. Her name or nickname is Cause. She goes by Cause.
Pause. Okay, that'd be great. Thank you. I had
How
a
about,
meeting. Corey, go ahead.
I'm thinking about Kenny, that publication that you and your colleagues put together on housing. I think that would be great to really maybe have you and your colleagues maybe just highlight some pieces that are relevant to our conversation.
Yeah, we're currently working on the update for this next year, so that typically gets launched over in August. So maybe that's a good time to get an update.
That would be fantastic. I love that. I met last week with somebody from the police department. Um, And I've heard good things about the police, although they're not, nationally not always the best when it comes to homelessness. But I know there is some collaboration. I also think some of the materials we're putting together might be really helpful for the police themselves. Um, just a thought. I don't kind of know how they work with the homeless sector here. Um, but it might be certainly a collaboration, certainly some conversations with them I think would be great, the hospitals as well. But whether we would want to bring them in to speak, I don't know. Does anybody have relationships with any of the hospitals in terms of this work? I'm sure the city must.
TC3 is the first thing that came to my mind. And they're a collaboration that involves what's the hospital at Grant and Craycroft, everybody? I can't remember.
TMC, yeah.
Thank you. Yes. Yeah.
Yeah, I know they do their teams where they sort of pair hospital folks with police and they go out on mental health calls, things like that. What I don't know is the training that the hospital worker has around people experiencing homelessness. I'm assuming it's good. I just don't know. Um, that might be something, and maybe I can talk to folks at the city. It would be, again, interesting to make some of those connections just to find out what we're doing. But I think we have Robert, we have the National Coalition, we have Kenny. This is great. Internal resources, Mindy.
Thank you. The first responders, fire and EMS. Perhaps also the 311 folks.
And 311 here in Tucson is for resources. Is that what it is, to find resources, or just so I'm clear? It's different in different communities, so I'm not sure what it is
That's
here.
correct. And 311's resource services.
Great. Um, okay, that's really a a great idea. EMS here, is it usually EMS is private and then fire department is public. Is that the way it works here? Does anybody know?
It's the Public Safety Communications Division, and their building is near Ajo and Park. Um, I'm trying to think. I mean, generally you could reach out to them and they could put you in contact with the right person. Um,
Okay.
just real quick, I mentioned TC3 and I finally looked at my notes and found. So TC3 stands for Tucson Collaborative Community Care. And it's the fire department and TMC. And in my notes, I see mission to reduce and prevent 911 calls, if that's helpful.
Thank you. I appreciate that. Yeah, I know we had a bunch of teams, but we would have, caseworkers. We call them care coordinators, working with the police and with the fire department. So I'm just kind of curious about where the hospital's at with that. All right, any other thoughts? And again, I know I'm putting you on the spot, so if you think of other people, local, I love some of the, connection with the housing. I think Kenny, your housing report in August would probably be great for the full commission. Um, A couple of these I think would be great for, well, I think all of them would be great for the full commission, but I think they wanted to have some speakers too, so we have to be respectful that they deserve some too. Although we're the better committee, what can I say? Don't repeat that, Nato. No, don't repeat that. Not in the minutes.
What about Primavera? I don't know if.
Yeah, we could certainly talk to Trisha
Mm-hmm.
about kind of what they're doing. Um, the other thing I think I had mentioned at the last meeting, we were talking about funding, is potentially having someone come from Funders Together for Housing Justice. And they're very interested in working in Tucson, but they work with funders. I don't know if they now work with government funders or just private. I may approach United Way to see would they be willing to host and invite us to something like that as a commission. They won't, like, service providers are not their audience, so they work with funders. But again, they do work with government. So as commissioners, that might be fine. And you could be there as a commissioner, Robert, and maybe find some really good funders.
That
These are the
sounds
big, these
great.
are the big, these are the big guys. These are some of the really big guys. So I can reach out to them and just ask them. Okay. Um, we're early. We've gotten through a lot today. Any other thoughts or comments, concerns? Mindy.
And apologies for not getting back to you quicker with feedback or acknowledgement of the work. So as if you are, is there a remedy that we want to talk about for that?
Again, I think what I would appreciate is just to make sure people get back to me to say received. And if you're just swamped and you can't get to it, that is totally understandable. I don't want to come down on anybody for that. Just let me know. Just say, Anne, I'm not going to be able to work on this before the next meeting, but happy to talk about it at our next meeting. That I just don't know if anybody's getting stuff or hearing or that's it. So as long as I know people are still engaged, that's all I need. So I will set up. I think I did have a question, Mike, because I had two emails for you, and I am wondering if that was one of the reasons there was a mix-up on your end, because I just want to make sure I have the correct email for you.
Yeah, sometimes people will send to both, and that's fine. If
Okay,
it's
so both are active, both work.
yeah, if it's city related for sure, send it to the city. But otherwise, the Gmails are good, because I see those right away. At least I mean in my inbox, I see that I've got them. Now, I do, again, it's probably a personal problem, but when I look at subject lines, if I don't see a date and a time, I mark it for read later.
Okay, thank you. That is helpful to me. I can do this and just say, please respond by X date or something if that's helpful to people.
Yeah.
Um, so it's just again, I want to make sure that people feel like they're engaged. And if you're busy, don't hesitate. I'm not going to come down with a sledgehammer in any way. There are times I've gotten, Neto will tell you, there have been times I've been bad too, and getting back to him just because I've been swamped. Any final thoughts?
Gratitude for all the work that you've done.
Thank you. I must admit, I have fun. So I do get carried away. So just slap my hand, say enough, enough.
Thank you.
Thanks, everybody. Great, great meeting. Oh, I guess we officially have to do a call to the audience. Is there anybody present? No. No?
No.
Okay. Thank you. So our next meeting is July 16th at 1 p.m. I know it's a summertime, so please just let me know if you can't make it or let Neto know.
Hmm.
Our full commission meeting, July 9th at 4 p.m. That was a change in date. So if that's everything, thank you all for your amazing feedback. I so appreciate you. This has been a really great meeting. And I look forward to moving forward with all of you. So have a great rest of your day.
Thank you.
Thank you,
Thank
Thank
you. We
everyone.
are
you.
adjourned.
Bye.
Bye-bye.
Everybody.
I always have trouble